Autism spectrum disorders, or ASD, are complex developmental disabilities. They affect how a person behaves, interacts with others, and learns. ASD is a spectrum disorder, which means it affects each person differently and to varying degrees. Some individuals with ASD may have mild challenges, while others may require significant support in their daily lives. Imagine a rainbow with its many colors and shades. This is similar to the spectrum of autism. Each individual with ASD is unique, with their own strengths, challenges, and ways of experiencing the world. There is no one-size-fits-all description of autism. ASD is a lifelong condition, but with early intervention and appropriate support, individuals with autism can lead fulfilling and meaningful lives. It is crucial to remember that people with ASD are not defined by their diagnosis. They are individuals with their own hopes, dreams, and aspirations. Autism is becoming increasingly common. It's important to spread awareness and understanding about ASD so that we can create a more inclusive and supportive society for individuals and families affected by autism. In the past, autism was categorized into different subtypes like autistic disorder, Asperger's syndrome, and pervasive developmental disorder, not otherwise specified, or PDD-NOS. However, the diagnostic criteria have evolved. Currently, these subtypes fall under the umbrella term autism spectrum disorder. The spectrum of autism encompasses a wide range of abilities and challenges. Some individuals with ASD may have exceptional memory skills, excel in specific areas like math or music, or demonstrate remarkable artistic talents. Others might find social interactions and communication particularly difficult. The severity and combination of symptoms vary greatly from person to person. This makes it even more important to avoid generalizations and stereotypes about autism. Each individual should be understood and supported based on their unique needs and strengths. Remember, the autism spectrum is not linear. It's not about being high-functioning or low-functioning. Instead, it's about recognizing the diverse ways autism manifests in individuals and providing personalized support that empowers them to thrive. While every person with ASD is unique, there are some common signs and behaviors that may indicate the presence of autism. These signs can vary widely in their presentation and severity, making each individual's experience with autism distinct. These can appear in early childhood, often before the age of 3, but sometimes they might not become apparent until later. Early detection and intervention can be crucial in supporting the development of children with autism. One of the hallmark characteristics of ASD is difficulty with social interaction and communication. This can manifest in various ways, such as challenges in forming friendships, understanding social norms, or interpreting the emotions of others. Children with autism might not engage in typical back-and-forth conversations, avoid eye contact, or struggle to understand social cues and nonverbal communication. They may also have difficulty expressing their own emotions and needs effectively. Repetitive behaviors are also common in individuals with ASD. These behaviors can provide a sense of comfort and predictability in an otherwise overwhelming world. These can include repetitive movements like hand flapping or spinning, or a strong adherence to routines and rituals. Such routines can be very specific, and any deviation from them can cause significant distress. Changes in routine can be distressing for individuals with autism. Even minor changes in their environment or daily schedule can lead to anxiety and behavioral challenges. Sensory sensitivities are another common characteristic of ASD. These sensitivities can affect how individuals with autism perceive and interact with the world around them. Individuals with autism might be overly sensitive to certain sounds, textures, smells, or lights. This hypersensitivity can lead to sensory overload, causing discomfort or even pain. They might seek out sensory input like deep pressure or movement, or avoid certain sensory experiences altogether. Tools like weighted blankets or sensory-friendly environments can help manage these sensitivities. It's important to note that these are just a few common signs and behaviors associated with ASD. The spectrum is broad, and each individual may exhibit a unique combination of traits. The presence of these signs does not necessarily mean a child has autism. Other developmental disorders or conditions can present with similar symptoms. A formal diagnosis should always be made by a qualified healthcare professional. Comprehensive evaluations often involve a team of specialists to ensure an accurate diagnosis and appropriate support plan. Section 4. Diagnosis. Unraveling the puzzle of autism. Diagnosing autism is a multifaceted process that involves a comprehensive evaluation by a team of specialists. This team often includes developmental pediatricians, psychologists, speech-language pathologists, and occupational therapists. The evaluation typically involves developmental history, gathering information about the child's developmental milestones, behaviors, and any concerns from parents, caregivers, and teachers. Observation. Observing the child's behavior, social interactions, communication skills, and play patterns. Standardized tests and assessments. Using specialized tools and assessments to evaluate the child's cognitive abilities, language skills, social-emotional development, and adaptive functioning. Diagnosing autism can be challenging, as there is no single medical test for the condition. It requires careful consideration of the child's developmental history, behaviors, and the presence of specific criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5. Early diagnosis is crucial for individuals with ASD. It allows for timely access to early intervention services, therapies, and support systems that can make a significant difference in their development and quality of life. Section 5. Early intervention, the key to unlocking potential. Early intervention is crucial for children with ASD. It sets the foundation for their future development and helps them navigate the world more effectively. It involves a range of therapies and support services designed to help children develop essential skills and reach their full potential. These services are often provided by a team of professionals who specialize in different areas of child development. The earlier these interventions begin, the better the outcomes for the child. Early intervention can significantly improve a child's ability to learn new skills and reduce the need for specialized services later in life. Early intervention programs typically focus on improving communication skills, social skills, and adaptive behaviors. These programs are designed to be engaging and fun, making learning a positive experience for the child. They often involve a combination of therapies, including speech therapy, occupational therapy, and behavioral therapy. Each type of therapy addresses different aspects of a child's development. Speech therapy helps children develop language and communication skills, including verbal and nonverbal communication. This can be crucial for children who struggle to express themselves or understand others. Occupational therapy focuses on improving fine motor skills, coordination, sensory processing, and daily living skills. These skills are essential for a child's independence and ability to perform everyday tasks. Behavioral therapy uses principles of learning and behavior modification to address challenging behaviors and teach appropriate social skills. This type of therapy can help children learn how to interact with others in a positive way. Early intervention is not a one-size-fits-all approach. Each child is unique, and their intervention plan should reflect their individual needs and goals. It should be tailored to the individual needs of each child, taking into account their strengths, challenges, and learning style. This personalized approach ensures that each child receives the support they need to thrive. Parents and caregivers play a vital role in supporting their child's development and working collaboratively with the intervention team. Their involvement can make a significant difference in the effectiveness of the intervention. By working together, therapists, parents, and caregivers can create a supportive environment that fosters growth and development, helping children with ASD unlock their full potential. Section 6. A spectrum of therapies, tailoring treatment to individual needs. Just as autism presents itself differently in each individual, so too must treatment be tailored to their unique needs. Each person with autism has their own strengths, challenges, and ways of interacting with the world. Therefore, a one-size-fits-all approach simply doesn't work. Instead, a personalized plan that considers the individual's specific needs and goals is essential for effective treatment. There's no single cure for autism, but a variety of therapies can help individuals develop skills, manage challenges, and live fulfilling lives. These therapies can range from behavioral interventions to speech and language therapy, occupational therapy, and more. Each type of therapy addresses different aspects of development and can be combined to create a comprehensive treatment plan. Behavioral therapies like applied behavior analysis, or ABA, are often used to address challenging behaviors and teach new skills. ABA is a widely recognized approach that uses principles of learning and motivation to bring about meaningful changes in behavior. It is particularly effective in helping individuals with autism develop social skills, communication abilities, and adaptive behaviors. ABA breaks down complex tasks into smaller, more manageable steps, using positive reinforcement to encourage learning. This method helps individuals achieve success in small increments, building confidence and competence over time. Positive reinforcement, such as praise or rewards, is used to motivate and reinforce desired behaviors, making learning a positive and enjoyable experience. Speech and language therapy is essential for individuals who struggle with communication. Effective communication is a fundamental skill that impacts all areas of life, from social interactions to academic success. Speech therapists work with individuals to improve their ability to express themselves and understand others, using a variety of techniques and tools. This might involve teaching verbal communication, sign language, or using augmentative and alternative communication, or AAC devices. AAC devices can range from simple picture boards to sophisticated electronic systems that generate speech. These tools provide individuals with alternative ways to communicate, empowering them to express their needs, thoughts, and feelings. Occupational therapy can help individuals with sensory processing issues, fine motor skills, and daily living skills. Sensory processing issues can make it difficult for individuals to respond appropriately to sensory input, such as sounds, textures, or movements. Occupational therapists use various techniques to help individuals manage these sensitivities and improve their ability to perform everyday tasks. Therapists might use sensory integration techniques, adaptive equipment, or strategies to help individuals navigate their environment more comfortably. Sensory integration techniques involve activities that help the brain process and respond to sensory information more effectively. Adaptive equipment, such as weighted vests or specialized seating, can provide additional support and comfort. It's important to remember that therapy is a journey, not a destination. Progress can be slow and requires ongoing effort and commitment. Families play a crucial role in supporting their loved ones through this journey, providing encouragement and reinforcement at home. It requires patience, consistency, and collaboration between individuals with autism, their families, and a team of dedicated professionals. A multidisciplinary team approach ensures that all aspects of the individual's needs are addressed, with professionals from different fields working together to create a cohesive and effective treatment plan. As individuals grow and develop, their needs may change, and therapies should be adapted accordingly. Regular assessments and adjustments to the treatment plan are necessary to ensure that the interventions remain effective and relevant. This dynamic approach helps individuals continue to make progress and achieve their full potential throughout their lives.